Welcome to the deep dive. Today we're getting into something microscopic but really important for our pets, mycoplasmas.
That's right. We're looking at mycoplasmosis in dogs and cats.
Yeah, these tiny organisms that honestly can cause a surprising amount of trouble. This is going to be our deep dive to kind of unpack what they are and what they do.
Exactly. We'll be using scientific info to, really explore these unique little microbes, how they affect dogs and cats, and how vets approach dealing with them.
Okay, so mycoplasmas. They sound technical. What are we actually talking about here?
Well, think small and simple. They're actually prokaryotic cells, some of the smallest that can replicate on their own.
Prokaryotic, okay. Like bacteria.
Sort of, but with a key difference. Their classification, molecules, literally means soft skin. And that hints at their defining feature. They don't have a rigid cell wall like most bacteria.
No cell wall.
None.
Oh.
And that's huge. For today, we're mostly focusing on the non-hemotrophic types, the ones that aren't primarily attacking blood cells.
Okay, no cell wall. What does that mean for them? How does that change things?
It changes quite a bit, actually. Without that rigid wall, they're very flexible. They can change shape. We call that pleomorphic. But it also makes them pretty fragile in some ways. They're vulnerable to things that target cell walls, like lysozyme, which is in bodily defenses, and certain antibiotics like penicillin.
So penicillin won't work on them.
Nope. Completely ineffective. Instead of a wall, they just have this three-layered membrane, mostly fats and proteins.
Yeah.
And interestingly, they need sterols, the cholesterol, for that membrane.
Sterols, like
Yeah.
they have to get it from somewhere else.
Exactly. They have to scavenge it from their host, basically. They can't make it themselves.
So they're flexible, a bit fragile, and need to borrow building blocks, like tiny microbial scavengers.
That's a good way to put it. And they're also quite picky eaters. Fastidious is the term. They need very specific nutrients. Yeah, they can't make essential stuff like, the building blocks for DNA and RNA. They absolutely have to get those from the host cell too. So that close relationship, it's not optional for them.
Right, they need the host for survival. How do they even multiply, being so minimalist?
They usually use binary fission like other bacteria. One cell splits into two. But sometimes their DNA replication and the actual cell division get a bit out of sync.
Out of sync.
Yeah, which can lead to these weird shapes like little buds coming off or even chains of tiny bead-like forms.
Chains of beads. Huh. And evolutionarily, where did they come from? That this source mentioned something about gram-positive ancestors.
Right. The idea is reductive evolution. They likely started out more complex, like a standard gram-positive bacterium, but as they adapted to being parasites, they shed genes they didn't need anymore.
Streamlining, basically.
Exactly, leading to a really small genome. And yeah, they ended up everywhere. Parasites, harmless commensals, even living on decaying stuff. They're found in all sorts of organisms.
Okay, so they're common, but you said they're often harmless. What makes them switch from just hanging out to actually causing disease?
That's the million-dollar question, isn't it? And honestly, the exact ways they cause disease aren't always crystal clear. Sometimes it's even debated. Often, they're just commensals.
Commensals meaning they just live there.
Yeah, living on mucous membranes, think respiratory tract, digestive system, genital tract, without causing any obvious harm.
So quiet neighbors most of the time.
Pretty much. But things can change. They have ways to attach specifically to host cells using receptors. And because they're so small and flexible, they can get really, really close to the host cell membrane.
Right up close.
Which is essential for them to siphon off those nutrients they need.
Okay, so they latch on and take what they need. But how do they avoid getting wiped out by the pet's immune system?
They've got tricks. Sometimes other proteins kind of stick to their surface, potentially masking them.
Hiding them.
Sort of. And even more cleverly, some can actually incorporate molecules antigens from the host's own cells onto their surface.
Wait, like wearing the host's uniform.
Exactly. It's a form of camouflage.
Yeah.
But it can also work the other way. Their antigens might get stuck onto host cells, potentially tricking the immune system into attacking the body's own tissues.
Wow, that's complicated. Sounds like it could cause autoimmune-like issues.
It potentially could contribute, yes. And as they grow, they release enzymes that break down tissues, ammonia, even hydrogen peroxide as a byproduct.
So they're not just passively sitting there when they cause trouble.
Definitely not. The buildup of these metabolic waste products like ammonia and H2O2 can directly damage tissues. Plus, some produce proteins that are toxic to host cells.
Okay, so what happens when the immune system does recognize them as a threat?
Well, the body mounts an antibody response, what we call a humoral response. You see IgM and IgA antibodies first, then IgG, similar to many bacterial infections.
But does it always work?
Not always effectively.
Mhm.
Sometimes the inflammation they cause involves this thick fibrous fluid, an exudate. And that exudate can actually shield the mycoplasmas from antibodies and antibiotics.
Like a little protective bunker.
Exactly. Which can make the infections chronic, harder to clear.
And you mentioned secondary infections earlier. How does that fit in?
Right. Some mycoplasmas, especially in the airways, can damage the cilia.
The little hairs that clear things out?
Yep. When those are damaged or destroyed, the respiratory tract can't clear mucus and pathogens effectively. It basically opens the door for other bacteria to move in and cause secondary infections, like pneumonia.
A domino effect, starting with the mycoplasma weakening the defenses.
Precisely.
Okay, this is making sense. So we know what they are, how they operate. What specific diseases do we actually see linked to them? Let's start with dogs.
Okay, dogs. Well, you can see gastrointestinal issues like colitis,
Okay.
musculoskeletal problems, particularly arthritis. Mycoplasma spumans is often implicated there.
Arthritis, huh?
Yep. And then a whole range of urinary and genital tract infections. Things like inflammation of the prepuce, urethra, prostate, bladder, kidneys, vagina, uterus, often involving species like M. canis and M. spumans.
That's a lot of the urinary and reproductive system.
It is. And speaking of reproduction, mycoplasmas and also related organisms called ureaplasmas are linked to problems like infertility, early deaths of embryos, abortions, stillbirths, weak newborns, even neonatal death.
Wow, really serious reproductive impacts. And respiratory.
Yes, definitely respiratory issues too. M. cynos is a known cause of pneumonia and upper respiratory infections in dogs. But other species can be involved too. M. canis, spumans, edwardii, and several others have been found.
Okay, quite a range in dogs. What about cats? Similar picture.
Somewhat similar, but with some specifics. In cats, you can see chronic joint and tendon inflammation, polyarthritis, and tenosynovitis, often linked to M. gatii.
Joints again.
Yes. And eye infections, conjunctivitis. M. felis is a big player here, thought to be responsible for maybe 5 to 25% of feline conjunctivitis cases.
That's a significant chunk.
It is. Like dogs, they can get urinary tract infections and reproductive problems like abortions, sometimes linked to M. gatii or ureaplasmas.
And respiratory in cats, too.
Absolutely. Pneumonia and upper respiratory infections associated with species like M. guttae, M. filamenutum, and M. filis. And one more for cats. Chronic skin abscesses have also been linked.
Skin abscesses. Okay, so they really get around the body. But if they're often harmless, just how common are they? Are most pets carrying these?
They are incredibly common, especially on those mucosal surfaces. The source material mentioned that for cats, something like 70 to 80% of healthy cats might have M. guttae or M. filis in their mouth or urogenital tract.
70 to 80%. Wow.
Yeah, it's high. In dogs, maybe not quite as high in healthy animals routinely,
Yeah.
but they're isolated much, much more often from dogs that are sick from samples taken from the lungs or uterus or prepuce, for instance.
Yeah.
And geographically, they're everywhere, worldwide.
Okay, so they're ubiquitous.
Yeah.
What tips the scale then? What makes one animal sick while another one carrying the same organism is fine? What are the risk factors?
That often comes down to the host's immune system.
Immunocompromise.
Exactly. If an animal's immune defenses are weakened, maybe due to another illness or medications like steroids or even cancer, these normally quiet mycoplasmas can seize the opportunity. They become opportunistic pathogens.
Taking advantage of the situation.
Precisely. Anything that impairs the host's normal defenses can allow them to cross those mucosal barriers where they usually live and cause problems elsewhere. Think of something like primary ciliary dyskinesia, a condition where the cilia don't work properly.
Ah, right. Impairing that clearance mechanism we talked about.
Exactly. Or, say, a viral infection damages the lungs first, that makes it easier for Mycoplasma to cause a secondary pneumonia. It's often part of a bigger picture, a multifactorial disease.
So other infections can pave the way. Anything else?
Stress is definitely thought to play a role. Overcrowding, like in a kennel or cattery, can be a stressor that potentially lowers resistance.
Makes sense.
And other underlying conditions in specific areas like urinary stones or tumors might make the urinary tract more susceptible to Mycoplasma infections. The main takeaway is it's rarely just about the Mycoplasma being present. It's usually that plus some other factor compromising the host.
Okay, so if a vet suspects Mycoplasma, diagnosis sounds like it might be tricky, given they can be there normally. How do they pin it down?
It definitely poses challenges.
Yeah.
Their changeable shape, their specific needs for growth in the lab, and because they can cause such varied signs, coughing, urinary issues, joint pain, infertility, you first have to rule out a lot of other things.
Like what?
Oh, viruses, other bacteria, fungi, parasites, even hormonal problems, depending on the symptoms. It's a process of elimination often.
Okay, so rule out the usual suspects. What tests can point towards mycoplasma?
Well, basic lab work might offer clues. If an animal has polyarthritis, for example, blood tests might show mild anemia, high neutrophils, those inflammatory white cells, maybe low protein levels. Urinalysis might show protein. But these are non-specific signs of inflammation, really.
Not definitive.
Not definitive. There are blood tests, serology, that look for antibodies against mycoplasma. But again, tricky to interpret. Antibodies might just mean past exposure, not necessarily that mycoplasma is causing the current problem in the joints or wherever.
Right. Can you actually see them under a microscope?
You potentially can. In samples from the affected site, like a conjunctival scraping, you might see these tiny variable shapes, koki, rods, filaments, but they don't stain well with the usual Gram stain.
Ah, because no cell wall.
Exactly. You need special stains like Giemsa or Romanowski. A more definitive way is using a fluorescent antibody test, which can specifically tag the mycoplasma in tissues or cultures. But sample handling is key. They're fragile. You need the right transport media, like Hayflick broth and quick processing.
Delicate little things. What about growing them in the lab?
Culture. You can culture them, yes, but again, not straightforward. They need complex, specialized media. If you manage it, they form these tiny colonies that often look like fried eggs under the microscope.
Fried eggs. Okay.
Yeah. But because culture is difficult and slow, molecular tests like PCR are becoming really important.
PCR looking for their DNA.
Exactly. Targeting genes like the 16S RNA. There's also a technique called PCR-DGGE that can help tell different mycoplasma species apart. These are super useful when culture is negative or you need a specific ID. And interestingly, for the polyarthritis cases, X-rays usually look normal. No specific bone changes.
So x-rays don't help much there. What about joint fluid analysis?
That can be helpful. In mycoplasma arthritis, the joint fluid often has lots of neutrophils, but they look non-degenerative, which suggests an inflammatory rather than purely infectious process sometimes. And similarly, in prostatitis, you might find inflammatory cells in the prostatic fluid, but standard bacterial cultures come back negative. That pattern can raise suspicion for mycoplasma.
Okay, quite the detective work. So let's say you've diagnosed it. How do you treat these cell wall-less critters?
Right, so knowing they lack a cell wall tells you that beta-lactam antibiotics, penicillin, cephalosporins are out. They won't work.
Okay, so what does work?
You need antibiotics that target other bacterial processes, like protein synthesis. So tetracyclines are a major group, especially doxycycline.
Doxycycline.
Protofloxacin, which is a type of fluoroquinolone,
Right.
and chloramphenicol are also listed as drugs of choice. The challenge is we don't really have standardized routine lab tests to see exactly which antibiotic will work best against a specific mycoplasma isolate from that particular pet.
So vets rely on general knowledge of what usually works.
Pretty much, yes, based on clinical experience and published data. For something localized like conjunctivitis, topical antibiotic eye drops are the way to go.
Makes sense. Are there important precautions or things to avoid?
Yes, definitely avoid topical steroids for mycoplasmal conjunctivitis. They can make it worse, increase ulcer risk.
Okay, no steroids for the eyes.
Right. And the tetracyclines shouldn't ideally be used in very young animals, under 6 months, because they could affect teeth and bone development. Also, tetracyclines and chloramphenicol are generally avoided in pregnant animals if possible.
Good to know. What if those main drugs don't work or can't be used? Are there backups?
Yes, there are alternatives. The source mentions drugs like gentamicin, kanamycin, spectinomycin, spiromycin, tylosin, erythromycin, nitrofurans, and other fluoroquinolones.
A decent list of options.
Yeah, but treatment often needs to be quite long. These infections can be persistent, so extended courses are common, and monitoring the patient's response is crucial.
Right, because they can hide out. What about prevention? Any vaccines?
Sadly, no. There aren't any commercial vaccines available for mycoplasmosis in dogs or cats currently.
Okay, so no vaccine. How about cleaning? Are the tough environmental survivors?
Actually, no. They're quite susceptible to drying out, to sunlight, and to standard chemical disinfectants. So good general hygiene, especially in places with multiple animals, can definitely help reduce transmission.
So cleaning and disinfection work well. Good. Overall, then, what's the outlook for a pet diagnosed with this?
Generally, it's good, provided the animal has a competent immune system and gets the right antibiotic therapy. Early diagnosis, appropriate treatment, completing the full course. Those are key for a successful outcome.
Okay, great. So let's try to wrap this up. We've covered a lot about these fascinating cell wall-less bacteria.
We have. They're common, often harmless residents in dogs and cats.
Right. But they can cause a whole slew of diseases: respiratory, joints, reproductive, urinary, especially if the pet's defenses are down for some reason.
And their unique biology, that lack of a cell wall, makes both diagnosis and treatment a bit different, sometimes challenging.
Yeah, definitely needs specific approaches.
And it's worth remembering their role in disease isn't always simple. It's often complex, involving multiple factors, not just their presence.
A very nuanced picture. This has been incredibly informative. Thinking about how they can sometimes hide from the immune system and are linked to so many different conditions, it makes you wonder, doesn't it?
Wonder what?
Well, what other, maybe more subtle impacts could these tiny organisms be having on our pet's health that we just don't fully understand yet? Something maybe we're only starting to scratch the surface of.
That's a really interesting thought. There's likely still a lot to learn about their full interactions with their hosts.
Definitely food for thought. And certainly something to keep in mind and discuss with your vet if you ever have concerns. Thanks so much for diving deep into this with us today.